Numbers are raging globally with reports of new variants of COVID-19 that are more contagious than other strands. Youths who are mostly asymptomatic are unknowingly becoming super spreaders, endangering the aged and the vulnerable. Back home in Nigeria, the Presidential Task Force on COVID-19 is still working with the Nigerian Center for Disease Control and the African CDC on the sequencing of COVID strands circulating in Nigeria to ascertain and confirm new strains. In the midst of all these alarming realities, some Nigerians are still flouting COVID-19 protocols. A lot more Nigerians are still in denial. How ironic. Welcome to 30 Minutes on NTA News 24. I'm Lydia Samson. Let's begin with a situation report. Are Nigerians consciously taking responsibility? How can the nation have the buy-in of all to mitigate community spread? I have the report. Some countries around the world have reported confirmed cases of COVID-19 variants that is thought to have emerged from the United Kingdom, a fresh cause for concern as new research has found it to be more contagious than other strands. It is in the light of this that scientists in the United Kingdom are warning the world that it is significantly more contagious. Nigeria has crossed 100,000 mark of confirmed COVID-19 cases and now ranks second in the number of new cases in Africa. The Presidential Task Force is still working with NCDC and Africa CDC on the sequencing of COVID strands circulating in Nigeria to ascertain new strands.
If we continue in the manner in which we are behaving as a people and as a nation, these figures would keep rising.
Avoid crowding, as we see in people under the guise of national identity number enrollment. There is absolutely no cause for this. If only people would voluntarily comply with advisories and guidelines.
If you are above the age of 60, if you have diabetes, if you have other comorbidities, now is the time to keep away from mass gatherings if you fall within this group.
Also, healthcare workers, they don't waste people's time treating and looking for malaria and typhoid and so many other possible causes of illness. The strategy now should be to rule out COVID-19 before you go for the others.
According to PTF, no state in Nigeria is immune to COVID-19 pandemic, even if infections are not reported.
There is no state in Nigeria that is immune to this pandemic, even if reports are not coming out of such states. In continuation of the NYSC engagement, out of the 35,419 in batch B, 731 tested positive compared to 108 recorded during the batch A.
It is sad that Nigeria is at the risk of losing the gains recorded towards mitigating the spread of COVID-19 in the last 11 months, but also of losing more lives to the virus due to flagrant disregard for COVID-19 protocols in many parts of the country.
You go up there, you still see people in crowded areas, maskless. You go out there, you talk to people about COVID, they tell you that you're just being deceived. And everyone now comes with one mentality or the other that is putting protocols that are meant to protect people into jeopardy. So the advocacy should be more of what sensitizes people that this thing may not have affected us as it has affected the other nation, but the fact is that it is out there, it is real. In the last 1 month, Nigeria has recorded almost 50% of the entire death recorded in the whole of 2020. That tells us straight away that what we did right then that made people to caution themselves, they should be told again that those things should not be thrown away, because this is the time to be more careful. When solution is near, that's when carelessness is more. And people should be told now that that carelessness is not what we need. We need to be a lot more careful.
Just as simple as putting on your face mask and washing your hand, and also getting the myth out of your head that COVID-19 is meant for only the whites.
The importance of a face mask cannot be overemphasized, especially when you're in an area where it's a little bit crowded or in public places. You must use a face mask.
People find it easy to believe falsehood because falsehoods tend to be convenient. So when you believe that COVID-19 is not there, then you don't have to wear a face mask. You don't have to do what seemingly feels inconveniencing to them. And therefore, if anybody sells something to you that, oh, this is false, it becomes easier for you to believe.
Where I know that I sit with a lot of people that we are not spread as it is, I will use it.
If every individual we adhere to the putting on the face mask, it will protect us a lot.
I need to protect myself from it because it's very, very important.
The standard precautionary measures already known to everybody should be put to practice strictly.
Medical practitioners are calling for more caution and the need for citizens to take responsibility to simply practice the simple steps of hand washing, use of alcohol-based hand sanitizers, and physical distancing to curb for the spread.
Social distancing must be respected. In fact, the alarming thing is schools that are about to open. We're worried about schools being open. We're also worried about people traveling all over. International travel has not been banned. People are moving in and out of the country now. Another one is even local flights now. People are exposed to it. I want people to be really conscious of it. Unless it is necessary, don't even travel. Don't even attend any gathering because this are there now. What are the super spreaders? Naming ceremony, burial ceremony, wedding ceremony, social gathering, parties. You'll be surprised how people are still organizing parties. You'll be surprised how during this last December and New Year period, how people still went about fixing parties, organizing parties, including celebrities. Football has come back. People are going there to watch football. So many social gatherings are going on now. People should be conscious of this.
The second wave of COVID-19 is raging, and for me, it's about taking responsibility and going as far as checking people before interviewing them.
People were in their houses, some people were not able to go to work, and it was because of the COVID-19. But if we can be able to stay safe, put on our face masks, it's going to help us come out and work again, because we are on the lockdown because we are trying to avoid the spread. So if we can be able to stay on the lockdown and avoid, touching and keeping in contact with other people, we'll be able to come out again. It will be faster for us to come out. But the more we keep going out, going to parties and going around super crowded environment, the more we keep going down into the lockdown and the economy keeps going down.
These people belong to the group of Nigerians taking responsibility.
I observe all the protocols. I work with my sanitizer and I'm always on my marks.
I'm wearing my mask and then always checking my temperature. The second wave of the COVID-19 is here and is real.
Ironically, the super spreaders cynically remain convinced that COVID-19 is not real, and as a result, they walk the street without face masks. Some, on the other hand, only carry the masks in their handbags or pockets, and when accosted, they quickly bring it out and wear it just to blend. Dr. Joshua Usman, Chairman, Clinical Practice Committee, Diff Medical Center, says Nigeria is in a difficult phase of COVID-19, with the new strand proving to be more potent.
It's quite an alarming situation. People are dying by the droves. In fact, some of these deaths, I believe, are underreported. The number of cases I also believe are underreported. I just believe that people will just key into this and understand what is going on and try to keep the measures that have been put in by government. This new wave came with new variants that they have not been identified. There are different variants in different countries, and even within a country there are 2 types or 3 types of variants. So it's quite alarming, like I said, and I believe that people should really try to believe that this thing exists. In fact, the number of prominent people that have died, 2 weeks ago we lost over 20 doctors in 1 week. I know many professors of medicine that have died. I know very prominent Nigerians that have died. It is no respecter of person. It is no respecter of social strata. Ex-presidents, serving presidents, current president, now all governors are surviving it. We are lucky that we've not lost any governor, but we know that senators have died of this condition. We know a very prominent person in the presidency died of this condition. I just want to plead to Nigerians, I want to plead to my fellow citizens to please appreciate and understand that this thing is real and is there. They must take precaution. We are all exposed now to it. They should forget about the social, the herd immunity that may be there. Herd immunity is not going to protect us. We need to protect ourselves, and we need to go into the vaccine to get a vaccine for this condition for our citizens.
For Nurse Omo Wamke, Head Accident and Emergency Camp David Nursing Corps, it is simply about avoiding large gatherings and maintaining social distance at all times.
COVID-19, this second wave, this pandemic, it came like a blow, higher than 2020, to be frank, because we have a lot of number of patients now. Just within 2 weeks of the second wave of this COVID-19, we lost about 20 doctors. 20 doctors were dead in Nigeria. Without number of nurses is even uncountable, clinical assistants uncountable. So to be frank, COVID-19 is very, very real.
They said since assessing the hope offered by the arrival of the vaccine is not accessible for all at once, Nigerians must imbibe laid down COVID-19 protocols with all diligence, as it is now a matter of life and death.
Trying to avoid this knockdown, let us try to follow the rules and regulations of the NCDC, which is very, very easy to observe. All they are trying to let us know is we should avoid all this large gathering. We should always use our face masks. Don't go out without face masks. Don't say this is my colleague in the office, I don't need to wear face mask. Let's wear face mask. Do you know where your colleague is coming from? Do you know who your colleagues have met with on the way? So let us try to use these face masks. Wash your hands, use sanitizers. If we can really follow the instructions, you know, we can be able to contend with it.
We must continue to advocate. We must continue to advocate. We must continue to plead to people. Religious leaders must come in. Community leaders must come in. The government must continue to talk. I want to plead with the National Orientation Agency to also create leaflets, create awareness in various dialects across the country so that people will understand and key into it and understand that we need to nip this on the board. We're all thinking that by December this will go, but it's rather increasing and it's increasing rapidly.
Moving on now, with some countries already on second wave lockdown, the experience of first lockdown was unpalatable and many lives and livelihoods were lost. What should Nigeria and Nigerians do differently so that the country, which is already in COVID-19 induced recession, is not further crippled economically? This is the highlight of our next report.
In March 2020, based on reports from the Nigeria Center for Disease Control on the rising cases of COVID-19 in Nigeria, the federal government imposed a restriction on movement in Lagos State and Abuja, the Federal Capital Territory, to stop the spread of the virus. The restriction also covered Ogun State, which shares boundaries with Lagos, but did not include hospitals, food shops, petrol stations, and other essential services. Although necessary at the time to curb the community spread of the COVID-19 disease, the lockdown, which was later extended to all the states of the Federation, posed a great challenge for the economy, where millions of people rely on their daily earnings for survival. 50-year-old Carlos Akowe from Kogi State was one of the numerous Nigerians displaced by the COVID-19 restrictions. The father of 4 was once gainfully employed in the hospitality industry until March last year.
Actually, before 30th March, when before the announcement, I was actually working in the hospitality industry, and that has been my only means of livelihood, where I take care of my children that are in school and pay my bills. But when I got the announcement that we should stop coming to work and our presence was no longer needed in our place of work as a result of the COVID-19 lockdown. Since then, I've been in the house, and only God knows how I'm managed to survive now. Yes, I've actually, because of the lockdown, it is even very difficult for you to have access or go out to look for a job because nobody was available. You cannot go to any office. You cannot go to any even companies to ask for a job because nobody was available because we were all locked up in the house. Out of job for about 10 months now. Since that, but I was lucky to have begged a neighbor who gave me a plot of land where I was able to farm a little beans, and you understand. And for it to come up, you have to take like some months again. You understand. Only I've been borrowing from friends who are well-to-do, and I've been borrowing. Right now, as I'm talking to you, if I go to them, they are tired of giving me because they don't even know when I'll be able to pay back because I'm out of job, and they don't know when I'll be employed or when I will get the job again. So right now, as I'm talking to you, I'm living between my hand and mouth.
Hearing his harrowing tales, one can easily understand Carlos' apprehension over a possible second lockdown.
Now, as I'm talking to you, we have not survived the effect of the first lockdown. The news of the second one knocked me down off my feet. And right now, as I'm talking to you, and I hardly sleep because of what I passed through now. If eventually the second lockdown comes up, then I don't know what is going to happen to me because I'm beginning to develop a BP already, which I never had before.
Just like Carlos, others recounted how the lockdown of 2020 affected their incomes.
We were not going to work, and we were not paid for those 3 months we were on lockdown up to when we resumed. So during that time, it was something else. So I was affected in so many ways, financially, health-wise, and otherwise. A lot of things happened during that first lockdown. Food became so costly, and living in general was very, very difficult.
Imagine those people that are not civil servants, that don't work for government, like business owners, and they were stranded. A lot of them were stranded. They did not have money to feed and so many things. So the first lockdown, the lockdown we had, it wasn't easy.
Yes, the first wave of COVID-19 was terrible, especially the lockdown, where people cannot feed, you cannot go out for daily economic activities. They said they are going to provide palliatives. Many of palliatives cannot get to the people that needed them.
In May 2020, federal government began a phase-by-phase relaxation of the restrictions on movements, even as concerned agencies continued advocacy and enforcement of COVID-19 protocols. By September, almost all aspects of life had gone back to normal, but not without some consequences on the economy. A report from the Nigeria Bureau of Statistics indicated that Nigeria, Africa's biggest economy, entered recession for the second time in 4 years, after a contraction in its gross domestic product for a second consecutive quarter. Economists attributed the development to the fall in oil prices as well as the negative impacts of the coronavirus pandemic on the economy.
This third quarter report, though a contraction, is much better than we expected. It's also much better than was projected by the IMF and the World Bank. This COVID-19 recession follows a pattern across the world today, with almost every country that has reported its GDP going into recession. Bringing it closer home, the South African economy in the second quarter of 2020 reported a negative growth of 50%. This is compared to Nigeria's negative growth of minus 6.1% in the second quarter of 2020. The trend of improvement between the second quarter and the third quarter clearly shows that this recession will be short-lived And it indicates that we could actually exit recession in the fourth quarter, or worst case, in the first quarter of 2021.
The news of a second wave of the coronavirus pandemic and the lockdown measures imposed in some countries, including the UK and America, has continued to elicit responses from Nigerians who believe that Nigeria cannot afford a second lockdown.
Our economy entered recession in the last lockdown, so we cannot afford to go from recession to depression. So it is very important that the economy remain open, that we run our system in the way that is the best practice, and then give advocacy advice to people in the rural area, people who have a different understanding about whether COVID exists or not, people who have doubt.
In lieu of another lockdown, what then is the way forward?
The thing I know is that I think that we don't even have enough report on the cases of COVID death in Nigeria, because there are a lot of people who have died in their communities, died in their various homes without proper assessment being carried upon them. Nigeria should know there have been unusually some high-rate deaths in Nigeria from between 2020 and 2021. So COVID is having a major impact to play on the kind of casualties that we're having in our country. So for the government, the best option for the government, I stand by my words, is to improve and enhance the level of advocacy that we're doing. Because people are not believing, because Africans have been saved from this pandemic, and the impact on Africans is not as huge as what has happened in developed nations, Europe and America itself. But people must understand that this thing is real. We have had people who have caught it, like Ali Baba, who have come out to become very angry and said that, look, people must believe this. This is real. We must save our communities. We must save our elderly people. We must save, our family members from contracting COVID, because we don't even have the facility to sustain the rising tempo of the situation as we speak. So for us to help the society itself not to be overwhelmed, for us to help our medical staff not to be overwhelmed, it is very important that this advocacy must be taken a little bit notch higher. So, and for the government to also be very proactive in getting the vaccine in town, so that we can vaccinate our health workers and then those who are most vulnerable to this disease. So it's very important. If we can approach in getting these vaccines, it will now make sure that we follow the other protocols and then ensure that lockdown does not come up in the second time.
What I think should be done is should make sure the citizens should observe the normal protocols of the COVID-19. And when you observe it, I think other activities can go on as I'm talking to you. The way I'm talking to you, I can go to the office, I can still do the normal job if the normal COVID-19 protocols can be observed.
Government should enforce all the COVID-19 protocols. They should make sure it is enforced. Before you go to any office, even in your car, make sure you are well protected. And with all if the measure is well taken care of, you don't need to lock anybody down. You don't need to. You are already protected. Now, if I protect myself like that, where is the transmission going to come from?
The way forward is that those restriction methods should be put in place, like using of the face mask, social distancing. But for the lockdown, I think there should be something else. The lockdown is too devastating on the economy and the lifestyle in general.
As the world continues to battle the pandemic, experts have continually harped on the need for citizens to take responsibility and join hands in the fight against this global disease by observing the COVID-19 protocols as laid out by the Presidential Task Force on COVID-19.
Remember, lockdown is better than to be knocked down. Wearing the face mask is better than being on a ventilator. Staying home is better than the ICU. Ultimately, prevention is better than cure. Please stay safe by taking responsibility and simply observing all COVID-19 protocols to safeguard the nation's health and wealth. God bless you. I'm Lydia Samson.
Nigeria, a nation of great people. Different tribes and languages, yet we are united in our diversity. All over the world, Nigerians are known to be very hardworking and resilient people. In our history as a nation, There have been many storms, but just like the